I'm Dr. Kutty, a board-certified plastic surgeon in Houston, Texas. Reshaping the tip of your nose does not have to mean having a major rhinoplasty. A tip rhinoplasty can be done simply, in the office, and with local anesthesia. Not having general anesthesia means feeling fine after the procedure, and the risks of general anesthesia are avoided. The cost of surgery is also significantly less, making the procedure much more accessible. I can make the tip of the nose completely numb so that a tip rhinoplasty can be done without causing pain. The patient is wide awake and simply gets up and leaves after the procedure. The first step in any rhinoplasty procedure is establishing exactly what the patient wants. Tip rhinoplasty involves numerous structures contained within a very small space, and very fine adjustments can be made depending on the patient's desires. The procedure starts with the anesthetic. This is injected over the entire nasal tip so it's numb and the procedure can be done precisely even though the patient's awake. This patient wanted the base of her nose to be narrower. There are several ways to accomplish this, and in this case I did something called a nasal sill resection. Removing a wedge of tissue from the base of the nostril pulls the nasal base together when the incisions are closed. You may have heard of alar base resection, which is a different procedure and produces a different change in the nostril shape. The other thing this patient didn't like about her nose is the flatness and drooping of the tip. To address this, the cartilages that form the nasal tip have to be exposed. They can then be adjusted with various suturing techniques to produce the desired degree of tip definition and elevation. An important thing to remember is that the shape that is produced by a tip rhinoplasty procedure won't be completely apparent for 6 to 12 months. With this local anesthesia, in-office procedure, your nasal tip can be transformed with a relatively minor procedure. Thanks for watching.